Hello, I am Marco Ruggiero, but as you will have noticed, the voice you hear is not my original one with its Italian accent, but rather a synthetic voice generated by AI that I use to improve clarity of exposition. As you know, Bravo products derive from a proprietary fermentation process that we invented more than 15 years ago, based on the observation of what occurs in the first days of life when, as mammals, we feed on the colostrum and milk produced by our mothers and ferment it in our gut. Both colostrum and milk contain many molecules with healthy biological properties, but this is nothing compared to what is produced through the fermentation process. Today, I want to bring to your attention a scientific work published by German and Turkish researchers. Turkey boasts a millenary tradition in the field of fermentation, demonstrating that the fermentation of bovine milk leads to the formation of as many as 236 new biologically very active peptides. Peptides are fragments of protein, and in this case they are defined as new because they were not present in the milk before it was fermented. In other words, the fermentation process causes the appearance of over 200 new molecules with incredible healthy properties. The scientific work published in the Journal of Proteomics titled Peptide Profiling of Bovine Kefir reveals 236 unique peptides released from caseins during its production by starter culture or kefir grains, represents a contribution of fundamental importance for the understanding of the molecular basis of health benefits deriving from fermentation. Through the use of cutting-edge analytical techniques, such as liquid chromatography coupled with high-resolution mass spectrometry, the researchers conducted a complete mapping of all peptides of bovine origin kefir. Please consider that bovine milk is very similar to human milk regarding the protein and peptide components, and the fermentation process of kefir is similar, albeit less complex, to that of Bravo. One of the most striking results of the research consists in the fact that these new peptides come from the fragmentation, proteolysis, of milk caseins during fermentation. The study highlights how numerous identified peptides possess formidable biological activities, ranging from immunomodulatory and antimicrobial effects to antioxidant, antithrombotic, opioid-like, mineral binding, and angiotensin-converting enzyme AC inhibitory properties. In other words, these peptides act powerfully on all our organs and systems, from the immune to the circulatory system. These results are perfectly consistent with our vision of the Bravo system and emphasize its scientific uniqueness. The research confirms, in fact, that the peptide profile and the consequent biological activity of the final product can be modulated and controlled through the accurate selection of the applied microflora, which, in the case of Bravo, is incredibly complex and shows an unparalleled degree of biodiversity. In this perspective, Bravo does not configure itself as a simple yogurt or a conventional kefir, but as a microbiome reconstitution system designed with rigor to optimize the specific production of biologically active molecules. Please consider that the work I am bringing to your attention is limited to the study of milk fermentation, and the results are already excellent. Think of how many more molecules and how much more active derive from the fermentation of colostrum, as in the case of Bravo products. In fact, colostrum, unlike milk, already possesses excellent immunomodulatory, anti-inflammatory properties, etc. Think of what a wealth of health-supporting molecules are generated when colostrum is fermented. After all, it is exactly what happens in our first days of life when the gut microbiome, given to us by our mothers, ferments the colostrum and milk we feed on. If a common commercial kefir, like the one used in the work cited here, is capable of generating such molecular complexity, the complex microbial consortium of Bravo, the result of decades of biological research, is studied to maximize the production of unique bioactive molecules, guaranteeing a biodiversity and a clinical efficacy that transcend traditional fermented products.